The challenge for all these hostages, once they are freed, is adjusting to life back home, knowing that dozens of hostages remain behind. Joining us now is James Phillips, a licensed mental health counselor specializing in trauma, especially those who serve in the military. You've seen a lot of patients like this, James. Thanks so much for being here. You've said these hostages, quote, they're not going to come back and be the same person that they were when they left. How does this traumatic experience change them?
So when you experience a trauma event, the thing that makes that trauma event clinically significant is the behavior change that follows. So you're looking at people that have been in captivity for a large amount of time, and it's not just one trauma event they're experiencing. They're experiencing trauma event after trauma event after trauma event. It is very hard to come back to society and not experience profound behavior change because of what you've seen and because of the everyday items that may all of a sudden be scary to you or uncomfortable to you.
What do you mean by that, everyday items?
One of the things that was referenced in the first interview, I think, is she talked about being walked away in tie wraps. Like
Judith
Judith
and her daughter had their wrists zip tied behind their backs. Yeah.
So that's the kind of thing that would trigger every day. So every day we do these things with our hands. How often do you put on a bracelet? How often does someone put their hand around your arm? How often do we get a bracelet to go into an amusement park? Every time that happens for her, she's going to be reminded of that time that she was walked away. And that's just the tip of the iceberg for her trauma.
And a study in the Journal of the Royal Society of Medicine said women and children in particular have a harder time recovering from being held hostage. Why is that?
Generally with somebody that is traumatized due to being detained against their will, the rule in therapy is generally the more vulnerable, the more traumatized.
And women and children are more vulnerable because children are small. And we heard Judith repeatedly talk about how Natalie was terrified. She was terrified of being raped while held in captivity.
Yes, of course. And that would be a big concern to anybody that's still held there.
And we do know from the United Nations report, as well as widespread reporting for months now, that the terrorists from Hamas were using sexual violence as a weapon of war, that many of these hostages were raped repeatedly and may still be sexually assaulted in captivity. I want to ask you about those first few hours after a hostage is released. They're very important, according to therapists. What should or shouldn't happen?
What you're doing when you're coming out of a situation like that, of course, the family wants to see you. Of course, there's a lot of people want to celebrate and be around you. Those few hours can be very traumatizing to the person just coming out, because remember, they've been in an enclosed space with a limited amount of people over a long period of time. And you come out, there's going to be everyday things that are going to startle you. Maybe a family member that haven't seen you in a long time wants to run to you and hug you. That may not be a good thing. Okay. The first couple hours, a person needs to be sheltered, fed, and left alone.
Yeah, not lots of questions, which can feel like an interrogation.
Right, because the time you spent there, your head's not even clear yet on acclimating back to society. All you know is you've been in survival mode, you've had trauma event after trauma event after trauma event, and somehow deep inside you know that this is probably over right now.
Judith says she's having trouble sleeping. Is that a common thing?
Yeah, the symptoms of PTSD, unfortunately, are very long-reaching. Sleep disturbance is a big one. Hypervigilance is another one. And the unfortunate thing about PTSD is you see the symptoms of those traumas on through your life through years to come. If you don't get treatment for your PTSD, you can see substance abuse creep up in your life. You can see anxiety disorders creep up in your life. You can also see more severe mental health problems creep up in your life without treatment. So it's very important that you receive treatment. It's very important that you have those symptoms attended to.
Another one of the hostages that was freed was a little girl. She emerged from captivity, and her father says now, or at least for the first few days and weeks after she was freed, that she would only speak in whispers.
Right. Yeah, that is a classic sign of a traumatized child. Okay. So what a child sees in a situation like that is they try to make themselves as small as possible, okay, as quiet as possible, as withdrawn as possible. And it's going to be a very long time before she understands she is safe. Even though she is safe by location, she may not be safe in her head.
Yeah.
So that's going to take some time for her to change those behaviors that she believed kept her safe there, and they very well may have.
Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.